Professor, Physician, Epidemiologist. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. In this video, I'm going to go over some of the data sets that are involved in creating something called the county health rankings. Now, if you've seen some of my other videos, you've probably seen me talk about county health rankings extensively when it comes to geospatial research. But when we're thinking about kind of what exactly entails this data set, a lot of times we don't really think too much about that. So this video I dedicated to looking at what exactly is within this data set, and you'll be surprised to actually see that there's 25 data sets that are included within the county health rankings. So there's quite a few types of information that is included here. So let's get started. So if we're thinking about, what we'll go over, there's about 30 measures, about 25 data sets that I'll be going over. What does this data set do? What does county health rankings do? Well, it allows to help communities understand exactly how healthy their residents are today. So, for instance, what are some of the health outcomes? And then the third part is understanding exactly what the factors are. So what will be the impact on their health in the future? So one of the major data sets that's included within the county health rankings is coming out of the National Center for Health Statistics. And there's about 6 measures that are part of the National Center for Health Statistics. So that's premature death, low birth weight, life expectancy, premature age-adjusted mortality, child mortality, and infant mortality. So these are the 6 main variables that are included within National Center for Health Statistics. Then the next one is National Center for Education Statistics. The reason I put this right next to National Center for Health Statistics is because of the similarity in the name. And there's one special measure that comes out of this, and that is children eligible for free or reduced priced lunch. Then one of the major nationally representative data sets, which is being used, not all the measures from there, but 8 of the measures are being used in county health ranking, are as follows. Poor or fair health, poor physical health days, poor mental health days, adult smoking, excessive drinking, frequent physical distress, frequent mental distress, and insufficient sleep. So then, thinking about diabetes and specific surveillance systems that try to look at diabetes. And as you're listening to these various data sets, what I encourage you to do is actually go in and look at what other measures and variables are available within these data sets, because there's actually a lot of additional information that you can glean from a lot of these sources, which are not necessarily included in county health rankings. But if you were to create a map, then you can easily relate additional measures and variables which are contained within the respective data sets but not contained within county health rankings, and then try to create conclusions from that. So here United States diabetes surveillance system, two major measures are adult obesity and physical inactivity. So another very important, this is one that I actually learned in my geospatial curriculum, is the American Community Survey, the 5-year estimates. So there's actually 7 important measures that I'll go over from the American Community Survey. And so the first one is high school completion, some college, driving alone to work, long commute, driving alone, and disconnected youth, and then residential segregation, black-white, and then residential segregation non-white. So some of the good variables, some social determinants of health can be determined because not only are we looking at education, but looking at factors like segregation and disconnected youth, where they might have graduated from high school, but then maybe they're not quite enrolled in college. They don't necessarily have an occupation yet or a job. So there's quite a few social variables that are potentially can be used for robust, unique research questions. So here's another one again. This is a singular measure that's there from this data source. And this is the USDA Food Environment Atlas, Map the Meal Gap from Feeding America. And this is where the Food Environment Index comes from. This is a measure that I've actually used in recent research. So a very interesting variable to explore. And then the next one is another singular measure, but very much something that can be explored for physical activity, obesity types of studies, and that is the access to exercise opportunities. And this is actually a measure that was created from shapefiles generated from the US Census, Esri, and Tigerline files. The next one is from the Fatality Analysis Reporting System. And I took a little bit of time to visit this registry, and there's actually other types of deaths that are incorporated into this, but alcohol-impaired driving deaths is something that is a measure included from here. From small area health insurance estimates, there's a measure on the uninsured. And then mapping Medicare disparities tools, there's actually 3 important variables, and that has to do with, one has to do with breast cancer, one has to do with flu. So preventable hospital stays, mammography screening, and flu vaccinations. These are the 3. And then National Center for HIV/AIDS, viral hepatitis, STD, and TB prevention, sexually transmitted infections. And then area health resource file, well, providers, provider access is important. So from the American Medical Association, the primary care physicians, the location is there. And then from the National Provider Identification File, there's the dentists. Then we have from the Center for Medicare and Medicaid Services, we have very importantly mental health providers. So here you can see we're covering physical health, primary care providers, dental care providers, and then finally mental health providers. And then Bureau of Labor Statistics is always important. I refer to this very often for different curriculum levels sort of decisions, but when we're thinking about the unemployed, unemployment can be taken from this. And then small area income and poverty estimates, SAIPE. So children in poverty is an important measure here. And then county business patterns, some social associations are incorporated within this measure. And then uniform crime reporting is even incorporated from the FBI. So violent crimes in local areas. And then from the environment, the Environmental Public Health Tracking Network, which is, again, another great resource that I encourage you to take some time to look into. But particularly air pollution, particulate matter is incorporated there. And then Safe Drinking Water Information System, drinking water violations. When we're thinking about comprehensive housing affordability strategy data, well, there's severe housing shortages and housing problems, and so housing insecurity happens to be an issue, and housing affordability. So this is another one. And then Map the Meal Gap provides information about local level food insecurity information. And that's really important because when we're thinking about hunger, this is one of the 5 domains in social determinants of health. And so addressing this in terms of economic instability, not necessarily food insecurity per se is one of the domains, but economic instability is. And so understanding food access, food quality, and the availability of food. Of course, from ED facts, high school graduation is something, and high school graduation rates is important. And then from the Stanford Education Data Archive, there's 2 things, reading scores and math scores. And so if you have environmental level data, for instance, percentage exposure to percentage of lead, or the concentration, mean concentration of lead in the county areas, and then achievement scores, then you can relate these two and see if there's an association. There's several studies that have been done to show that relationship. Again, when we're thinking about the environment, and tomorrow happens to be actually Earth Day, the Environmental Justice Screening and Mapping Tool, the EJ Screen, is extremely important to be able to relate a lot of these environmental factors with equity-related solutions. And so using these robust tools and finding how to apply this and use this effectively in your work, in your whether it's public health work or criminal justice or social work, how do you incorporate this? And with environmental concerns, this would be more in environmental, maybe engineering or environmental health. So last but not least, but quite a few measures that are incorporated within the most recent census population estimate. Is about 11 measures that I'm going to go over. So just the general population, what is the number? Percent below 18 years of age, percent 65 and older, percent non-Hispanic Black, percent American Indian and Alaska Native, percent Asian, percent Native Hawaiian, other Pacific Islander, percent Hispanic, percent non-Hispanic White, percent females, and percent rural. So what I encourage you to do is I've gone over 25 data sets and quite a few measures in the last 13 minutes or so. So I encourage you to go in there and start relating some of these, and then also conducting some of the analyses that I've gone over in some of the other videos. Another one I wanted to look at when you're thinking about ethnicity on a geospatial level is the predominance analysis. So looking at areas where there's majority and minority population. And also when you're thinking about education, highest level of educational attainment, this could be another place that you can do a predominance analysis. So I leave you with that. There's a lot of things to learn in the area of geospatial sciences, and I hope some of this has helped you understand the major resources out there for this useful tool. Thank you for listening.